Hi, hello friends, how are you? I hope you are doing good. Today I am going to talk about which is the best branch to join after MBBS. Many people ask me, sir, which is the best branch? Cardiac, surgical branches, medical branches. So basically, I want to tell them the branch whichever they feel they are interested, that is the best branch for them. If you are really interested in orthopedics, you can join orthopedics. If you are really interested in radiology, you can join radiology. If you are a kind of guy like any branch is okay, which branch is relatively easy to settle and earnings wise better. So in those cases, so let me tell you branch by branch. So when I joined MBBS in 2007, now it's 2020, 13 years passed. So lot of things have changed. Almost every branch is getting saturated year by year. So if you are in a surgical branch, so I have taken MS General Surgery, then definitely you need to do some super specialization like plastic surgery or a vascular surgery, urology, neurosurgery, etc. So with just MS General Surgery, it is difficult to survive at corporate hospitals or multi-speciality hospitals or in metro cities, because now the awareness among the public is more. So whenever they get some doubt, they'll just Google it, they'll go to the concerned super specialized doctor. Okay, so if you are interested in doing super specialization, do MS General Surgery. If you want to become a surgeon, then that particular super specialization. Then if you want to do, if you are interested in medical branches, do MS MD General Medicine, then super specialization. Okay, coming to best branch, it basically depends on your mindset. And many people feel orthopedics is an end branch. Once you take orthopedics, once you finish your MS orthopedics, then you can easily settle. So it's not the case. Orthopedics is not an end branch because there are many subspecialties in orthopedics like arthroscopy, joint replacements, spine surgery, hand microvascular surgery, pediatric orthopedics, limb reconstruction. So there are many subspecialties in orthopedics. So once you finish your MS Ortho, then you again have to do some kind of specialization in that particular subspecialty. So when you opt for anesthesia, I feel it is better than orthopedics regarding earnings wise. You can have fixed salary, but you will have a little stressful job. You will be working in ICUs or you have to attend cases. You have to give anesthesia here and there, going to the different hospitals and all. So after anesthesia, you have got a chance to do critical care, where your earnings wise, settlement wise, I feel critical care people will have an edge definitely over MD general anesthesia people. Then coming to pulmonology. Pulmonology is really good branch. It's not that saturated when compared to orthopedics or general medicine. So you can definitely opt pulmonology. Pediatrics, yeah, pediatrics is also better than orthopedics. Orthopedics is better when you want to settle at rural areas or municipalities, like places where there is around 1 to 2 lakhs population. In cities, definitely difficult. Then non-clinical branches, yes. If you want to settle at medical colleges, don't want to take the headache of, seeing the patients, treating them, following the patients. Sometimes nowadays, patients are beating the doctors. All these headaches, yes, definitely joining in medical colleges is a good option. So basically, it depends on your interest which is the best branch. Every branch is good. Like, it depends on your interest. Orthopedics is good. Joint replacements, arthroscopy, spine surgery. There are many subspecialties. Coming to surgical branches is CTVS, urology, gastroenterology. Everything is good. It depends upon your mindset, the place where you want to settle. Some branches, like initially, you need not have any type of investment, like pediatrics, general medicine, basically medical branches. You can just go start your practice. But some branches like orthopedics, especially arthroscopy, you definitely require some kind of financial support to start your own practice. And some branches like radiology, anesthesia, nuclear medicine, they are like dependent branches. Like, you need to work in a diagnostic center or a corporate hospital or a place where advanced radiological diagnostic centers are available. Like, if you are a nuclear medicine guy, you should be working in a big hospital where the PET CT scan is available, where the oncology facilities are available. If you are an anesthetist, definitely you should be working in hospitals where regularly surgeries are going on. If you are a critical care guy, you should be working in ICUs. So, multiple factors decide on what particular branch you should decide. So, it's ultimately your decision. And one more thing is, if your parents are already settled doctors, they are into one particular specialty, so getting into that particular specialty is easier for you. You get recognized earlier. Even though that applies to a smaller place, like smaller localities. In cities, it's difficult for a fresher. So, thank you guys. Bye bye.